When you move your neck, you may notice sounds resembling sand, clicks, and creaks. It's natural to feel a bit anxious when you're uncertain about the cause. Rest assured, I'll provide an explanation of why this happens and offer solutions to address it. Hello, how is everyone doing? Welcome to Physiolution, the channel dedicated to physiotherapy and promoting overall well-being. Today, I want to address a concern that many people have, that uncomfortable sensation in your neck when you move it, often accompanied by creaking sounds and noises. It's a common experience, but it can still be quite alarming. If you're unsure whether it's normal, you might be anxious, so brace yourself for this video, as it will address your concerns. To allay your worries, I wish to transmit a message of tranquility. Allow me to alleviate your concerns with this calming communication. These neck sounds aren't a worry unless there's pain. They're common, and I'll share the three main causes. One reason that commonly leads to changes in joint pressure is when there are alterations in the forces applied to the joint. This factor is frequently observed and can have significant impact on joint health. Synovial joints, including the cervical joints, consist of a joint capsule that is filled with synovial fluid. These joints play a vital role in allowing smooth movement and flexibility in the body. This essential function of cartilage involves lubricating and shielding it from potential damage. When we move our bones, it leads to a change in pressure within the joint, resulting in motion. This alteration occurs as we create movement. This process can generate tiny gas bubbles, which may occasionally burst, resulting in a cracking or clicking sound. It is possible for these gas bubbles to cause small fractures or clicks to occur. When we rotate our neck in various directions, such as to the sides, upwards, or downwards, these shifts in pressure occur. Hence, as we move, we perceive the audible sensation of crackling or popping. The pressure, which was initially felt, resurfaces after approximately 20 minutes, causing the neck to crack again. This recurring phenomenon is observed due to the duration of time that has elapsed. A common reason behind the occurrence of sounds or clicks in the neck is the displacement of a ligament or tendon near the neck muscles. This phenomenon takes place when these flexible tissues shift their position, resulting in a discernible auditory disturbance. The ligament, as well as the tendon, is a type of soft tissue that exhibits a certain degree of mobility. This is especially noticeable when we engage in movements involving rotation or tilting of our neck. That ligament or tendon has the potential to come into proximity with the bone, resulting in a minor level of friction that could mimic the sound of sand in certain instances. One possible reason why the occurrence of neck noises tends to increase as people age could be that the impact of aging affects this phenomenon, is that these ligaments and tendons might experience a slight decrease, resulting in increased friction. However, it should be noted that this hypothesis is based on limited scientific evidence, as there is still uncertainty about whether age plays a significant role in causing this joint noise. It is believed that even healthy tendons and ligaments can produce sounds and clicks, implying their functioning. Sometimes the noise our neck makes may occur due to rubbing between the bones in the cervical region, which is the third most frequent reason. This is quite concerning as it is frequently accompanied by discomfort. If there is pain, it is advisable to have it checked out so as to identify the underlying issue. In the presence of osteoarthritis, the friction between cervical bones can worsen, leading to intensified discomfort and potential pain escalation. This may result in accelerated discomfort. The natural process of aging can be further accelerated if we have experienced various neck injuries, such as whiplash, throughout our lives. This acceleration can contribute to the deterioration of our necks. Impacts or trauma in the area can make that friction even slightly greater. As I mentioned before, you can determine if this is our issue by the presence of any discomfort. Tally shows this passage has 144 characters. Usually, this type of noise occurs with each and every movement. It's not an occasional occurrence. Specifically, whenever I rotate my neck towards the right, for example, it cracks and hurts. If that occurs, see a doctor. After carefully examining the three primary factors responsible for neck noises, it becomes apparent that it is a complex issue with multiple causes involved. A solid routine of neck muscle mobility, strengthening, and stretching is known to aid us greatly. This includes exercises that improve flexibility and stability. Our aim is to minimize the disruptive noises and provide relief from any pain. To achieve this, we will break down the routine into three dimensions: mobility, strengthening, and stretching. To begin, the initial part will concentrate on improving neck mobility. We will perform 4 specific movements, starting with the first one. Move the chin toward the shoulder while performing this rotation. Always maintain a slow and deliberate pace in order to prevent mistakes, dizziness, and we'll act 2 sets of 10 repetitions to each side. First, we would go to the right, and afterward, we would do the same. The chin should be directed toward the left shoulder. 2 sets of 10 repetitions. Try not to do them back to back. Let at least some time pass. Take 30 seconds between sets to prevent any possible dizziness that might arise. The second mobility exercise is similar yet different. We will bring the ear to the shoulder. After that, we will perform this process of lateralization. Don't worry because you may have more mobility on one side than the other. It's completely normal. Many of us experience this. Only if pain is not experienced. It's all right. Let's move 20 units to one side and then 20 units to the opposite direction. The other. You see that here to the left it turns a little less, but it's okay. That's what we work for. We gradually mobilize 2 sets of 10 repetitions. Translate the task. We are going to lift the chin up. Gently lift your chin towards your chest, aiming to raise it as high as possible. Ensure that your chin does not move towards your stomach, but instead stays focused on lifting upward, toward the sternum. Performing this task. We would also do 2 sets of 10 repetitions. Always very slow and controlled movements. And now for our last exercise. We'll focus on mobility in the opposite direction, extending, and we want to bring the crown area to the back of the neck. Looking upward, moving the eyes along with it. Take it slow. 2 sets of 10 repetitions. If any of these movements cause dizziness, don't do them. But if not, we will focus on working the next mobility in all directions. Next, we will transition to strengthening. We will now perform a strengthening exercise for the double chin position. You might have encountered this in other videos, yet it remains an exceedingly fascinating topic and extremely significant. So how are we going to achieve it? One method is to create resistance using our hands while in this specific posture. And from here, we will do this double chin position to push the chin out. And we will do it without lifting the head of the hands. And we will keep it there for 10 seconds. You'll find that over time, you'll be more comfortable in the position. And we will wait for 10 seconds and perform the task at the same time. 3 sets of 10 seconds of this double chin gesture. Strengthening task 2 for optimal results. Now, let's shift our focus to rotations, but this time, let's introduce a slight element of resistance. To do this, we'll employ the use of 1 or possibly 2 fingers and rest them upon the chin. The hand will exert a certain amount of pressure in that direction, and I need to counteract it using my neck. Moving in. It should be a force of around 30 to 40% of our strength is being utilized, and it's worth noting that we are not engaging in hypertrophy exercises. We perform 2 sets, each with 10 repetitions, on a single side, and then to the other. There we go. During our strength training phase, our main emphasis will be on performing lateral movements. Can you suggest strategies for accomplishing this? Instead of applying pressure under the chin, try exerting it on the ground using the heel of your hand or a finger, whichever is more comfortable. The essence of the text remains unchanged. From this point forward, we will proceed. Bring the ear toward the shoulder while overcoming a slight resistance applied with the hand. Likewise, we will work in 2 sets of 10 repetitions on one side, as then on the other. After completing the strength training, we proceed to the stretching segment in our workout routine. I have only chosen 3 stretches for you, the most basic neck stretches, but on our channel, you have videos with many more neck stretches. The first one we are going to do is bring your ear towards your shoulder, and once you're here, we'll use our hand to increase the stretch. Most likely, many of you are experiencing tension at this place. If not, well, it's bound to happen. We are going to take the opposite hand and put it back here to slightly lower the shoulder, and keep it here. 20 or 30. Always with a feeling of stretching, but not of pain. That is important. We will proceed in the same manner in order to achieve the desired outcome. Tilt your ear towards the shoulder, add tension with your hand. If it doesn't stretch yet, we pass the opposite hand back, and that's where we would maintain it. Our 20 or 30 seconds of stress. For the second stretch we're going to perform, we will bring the nose towards the armpit. We will begin with the right side, just like we did before. I will bring the nose toward my armpit. With this hand, I'll extend a little further to reach what I desire, pushing my limits. And just like previously, if I don't experience substantial tension, I will move my hand backwards in order to slightly decrease its position. For the upper part of the humerus bone, to decrease its position, hold the shoulder for approximately 20 to 30 seconds to maintain the position. We will repeat the process on the opposite side, completing 2 or 3 sets during each iteration. Now we go down, we raise to increase flexibility and elongate. From this point, we hold for 20 to 30 seconds, always with a sense of slight discomfort, but never painful. We return slowly. And the last stretch I'm going to suggest will be for the front part of the neck, the sternocleidomastoid area. How will we perform this? We will tilt the chin towards the shoulder, and now we will bring it back. Some of you may already sense tension here, as there is a growing uneasiness in this area. If you are unable to perceive it, we can extend our hands to hold on to the collarbone where the muscle concludes its course, and we will moderately decrease it, maintaining. Let me guide you to the opposite direction so you can see it. Chin towards the shoulder, return to the initial position, and extend the stretch further. We add more here. To effectively work out, we maintain each posture for about 20 or 30 seconds, completing 2 or 3 iterations for each one. I truly hope that all your doubts have been resolved and your worries have been alleviated regarding the phenomenon of your neck cracking sporadically instead of consistently. Taking that into consideration, if you show us support by giving us a thumbs up, it greatly assists us. If you have any queries, feel free to leave a comment. Furthermore, if you subscribe and hit the notification bell, we will provide you with regular updates regarding our videos every week. As we always say, until cooking and beyond, bye.